is the one thing everybody's going to be talking about tonight.
The heat is the thing. With temps in the 90s and the heat index at 100, it'll be uncomfortable and dangerous. Dr. Brian Mamerow is an ER physician with St. Mary's. He's here with some timely tips. And good morning, doctor. Thanks so much for joining us. We appreciate it. I know you've already had people coming in, and it hasn't been in the 90s yet.
Correct, yeah. We've actually, over the past week, personally seen several people that have had heat-related illnesses, even with lower temperatures. So it's certainly going to be a concern with what the forecast is for today.
And you were saying during the break, it's not all elderly people, as you might expect. It's all ranges.
Certainly, the people at extremes of age are more at risk for heat-related illness. Folks over the age of 65, and then infants and children, especially kids under the age of 4. But we see all age ranges that are affected by the heat.
Yeah, we're seeing some pictures now of kids staying cool. What are some of the things that you should look for in terms of heat stroke and heat exhaustion?
So heat exhaustion, the symptoms of that are commonly dizziness, generalized weakness, fatigue, headaches, nausea. And heat stroke is kind of a step up from that. More severe, it can be actually quite dangerous, where your body temperature can get quite elevated, usually 104, 105 and above. And then with heat stroke, it's a lot of symptoms of heat exhaustion, but also some changes in people's mental status. You may see some confusion, even coma, seizures, things like that.
I guess you want to stay indoors during these days, if at all possible, but if you have to be outside, what do you suggest?
So a couple of things, if you do have to be outside, the best thing is to do whatever you need to do outside during hours where it is a little bit cooler, earlier in the morning and then in the evening. Certainly trying to get into the shade and rest periodically is very important. The type of clothing you wear can certainly affect how your body responds to the heat. Wearing lightweight, light-colored, loose-fitting clothing is important. And then, certainly fluid intake is really one of the most important things. Drinking a lot of fluids and drinking the right fluids. Things like water, sports drinks like Gatorade, things like that are important.
Yeah, it's Wisconsin. People might be thinking beer.
Certainly, and alcoholic drinks and even caffeinated drinks can actually make your dehydration worse. So certainly avoid those things.
All right. Well, we certainly appreciate you coming in. There's so much more we could say about it, of course, but thanks for the tips and the information.
Dr. Mamerow, thanks for being here.
Thanks for having me.